The chair will now recognize the vice chair of the full committee, Representative Garcia from the great state of Illinois.
Thank you, Madam Chair, Ranking Member, and to the witnesses joining us today. Even before the pandemic, we've known that resources within the Indian health system were stretched thin. Urban Indian health centers, in particular, play a critical role in providing health care to indigenous communities and remain on the front lines during the pandemic, all of which they do while dealing with long-standing parity issues within the Indian health system, supply shortages, closures, and financial hardships. We cannot afford to leave urban natives without access to adequate care during this public health crisis, especially. Mr. Smith, can you speak on the impact that COVID-19 has specifically had on the urban Indian communities?
Thank you very much, Representative Garcia, for the question. And I think as a starting point, I don't think there's anybody in this country who is immune to the impact of COVID-19, whether it's myself, tribal leaders, my neighbor. This really impacted everybody as a country, within our country. However, what I can share is that through our tools of tribal consultation and urban confer at the Indian Health Service, we had the ability to gather input in a very expeditious, short-term manner to make some important decisions, whether they're related to funding or if they're related to developing tools to help bridge some of the questions related to accessing supplies, staffing shortages, or just to raise issues that come quickly. At the Indian Health Service, we were able to stand up what we call our incident command system structure, where during the height of the pandemic, we were holding daily meetings to be able to raise issues up the chain all the way to the White House level. And this communication and magnification of issues as they are encountered daily really made a difference in developing some of the tools that we have now available on our website. We're working with other federal agencies such as FEMA or the Department of the Interior. I truly believe that these policies that we have in place really created the framework for us to have those important and needed conversations. But in a nutshell, every facility, whether it's a tribal health program, an Indian Health Service facility, or an urban Indian organization, were impacted by the pandemic in one manner or another.
In your testimony, you describe that urban Indian organizations have expressed that and I quote, need to confer with other HHS divisions is even more critical due to the pandemic and need for interagency collaboration. Why is there now an even greater need for UIOS to confer with HHS and not just the Indian Health Service? And be mindful, you've got about a minute and 20.
Yes, absolutely. I'll be brief. Again, pointing to our tribal consultation experience, the department as a whole has a policy which applies to every operating division on how we consult with Indian tribal governments. Having similar, that expresses or extends that to urban Indian organizations would level set the conversations. In addition, we were talking about the Executive Order 13175, which really extended the tribal consultation across government. So there is opportunities to enhance interagency collaboration through an expansion of the policy.
Okay, thank you very much, Madam Chair. I'm running out of time, so I yield back.
Thank you very much, Representative Garcia. The chair will now recognize the gentleman from Illinois, Representative Garcia.
Thank you, Madam Chair. Um, in the first panel, we had the opportunity to hear from the sponsors of bills and agencies. Um, Now we are hearing from those who work directly in indigenous communities and to see and hear about the inequities firsthand. A question for three questions for Mr. Murillo. Thank you for joining us today, first of all. Can you walk us through the missteps that have occurred during the COVID-19 vaccine distribution and how urban policies could have prevented this?
Thank you, Congressman Garcia, for the question. Um, I think without formal policies, working with UIOs, it becomes hit and miss. As I mentioned, my own experience here in Phoenix, having a very good and open relationship with the IHS area, we were very much included in the decision-making process. But as the president of NACUI, I'm very well aware that a lot of our members weren't aware that choosing a jurisdiction on where to receive that vaccine, either through the state or through the Indian Health Service, wasn't made apparent to them. And I think I can illustrate what happens when something like that occurs. In that, when we started receiving vaccines, basically day one that the Indian Health Service started receiving vaccines, we started distributing them to our elders in our immunocompromised communities right away. And other UIOs who might have chosen the state, they had to get in line. And as we know, the impact on urban Indian communities was very severe. And so having faster access to those vaccines, had they chosen the Indian Health Service as the delivery route to the vaccine, would have greatly helped some of the UIOs. So had HHS had a process for discussing that with urban Indian health programs, it might have prevented the delays that many UIOs experienced in receiving the vaccine and giving that to their elders and immunocompromised patients. That's one case in point. And another is with the CDC. Now, we understand that the government-to-government relationship requires HHS divisions to consult with tribes, and is right. But when divisions see that very finitely, that really locks out urbans. So we're not included in those discussions. So the consideration of how vaccine, how appropriated dollars, how other resources should come to UIOs we're not asked, and there's no requirement to ask us, and thus we're left out, or we're worse, an afterthought. And so I think those are some areas I can directly say impacted during this crisis.
Thank you. And finally, what HHS agency do you wish UIOs could confer with, and why would that improve outcomes for urban Indian health?
Well, we can see from the benefit of the Indian Health Service confer policy that really has positive impacts on the operations of UIOs. One area that I highlighted that might be where we interact quite a bit is also HRSA. Because of the workforce development and loan repayment programs, the HPSA scores, for example, that affect UIOs as FQHCs, qualified health centers. The 340B drug program and the turmoil we had last year, having just one contractor, and the really cutoff of prescription medications and the access to them really impacted us quite a bit. And also to the CDC knowing and understanding data about the health status of American Indians in the urban areas is also very, very important.
Very well. Thank you very much, Madam Chair. I yield back.